Hello and welcome. My name is Dr. Jim Hotz. I'm a practicing internist and I've been in South Georgia as Clinical Service Director of Albany Area Primary Health Care for the past 40 years. We've seen over 4 million patients in those years, and I have a pretty good idea about some of the big health problems that affect Georgians. And number one on the list that we fear is cancer. It's the second leading killer and soon to be the number one killer in Georgia. In fact, 16,500 Georgians die from cancer. I have, for the last 15 years, been chair of the Georgia Comprehensive Cancer Planning effort, and we have targeted in this year's new plan, which will come out in 2020, 5 main cancers. These cancers are lung, colorectal, breast, cervical, and prostate. The reasons we've identified them is over 55% of all Georgians who die of cancer die from these cancers. And our biggest killer, our number one killer, is lung cancer. Lung cancer accounts for 30% of those deaths, or nearly 5,000 deaths per year. So in our cancer plan, highly featured is lung cancer. And now that we have a screening modality that's very effective in reducing death rates from cancer, we want to make certain that it's available and offered to all Georgians. We, in the last cancer plan, were the first state in the nation that added lung cancer screening into the plan, and now 18 other states have followed this example. So we have already identified ourselves as one of the national leaders. In 2017, we started the first lung cancer roundtable in the state, and we welcome you to participate in these efforts. What we do know is that we can save countless Georgians from dying of lung cancer if we get screening out. One of the great tragedies about lung cancer screening, and even though the lung cancer screening trial in 2010 showed conclusively could reduce death rates of over 20%, and in 2015 the CMS made this available so that people can get screening at no cost to themselves if they're commercially insured or Medicare insured. Despite having this advantage and having a way of paying for it, only about 3.9% of people nationally have been screened who should be screened, and only 10% of people in Georgia. Now, it's great we're at 10% and we're a national leader, but that is far short of what our goals are going to be. So what our real ask is now is that you actively participate in lung cancer screening, that you let Georgia continue its leadership and make it number one in the nation in screening. Our lung cancer roundtable has been led by a number of organizations, over 50 in the state, who are committed to this purpose of making Georgia the tops in the nation. We now have 55 ACR, American College of Radiology, certified sites, and we want everybody who's doing screening in the state to be certified. So we have a lot of goals, we have a lot of lives to save. But why do we really do this? Well, in 2003, I lost my own mother to lung cancer. She had no chance to see her 29 great-grandchildren and only saw a number of her 20 grandchildren when they were very young. And lung cancer stole over a decade of life from her. In 2003, there were not screening modalities available. You are committed to die of lung cancer, and all of us who've taken care of lung cancer patients know that it's a brutal death, usually less than 1 year, and comes all too soon. With the modalities we have now available, we can turn this around. We welcome you to join this effort to make Georgia number one in the nation, and we're looking forward to very productive efforts through our lung cancer roundtable. Thank you very much.